I rise to speak about chronic and persistent pain as a matter of public importance. September is International Pain Awareness Month, which is part of an annual global campaign to help spread awareness of issues related to pain. According to Pain Australia, there are 3.6 million people who suffer from chronic pain in Australia. Some studies have put the figure as high as 1 in 5. Living with chronic pain can be exhausting. It's often invisible, hard to describe and challenging even for those who can get help. Honourable Speaker, chronic pain can affect a person's use of healthcare and ability to work, exercise and socialise. While research and treatments are improving, many people are still struggling to be heard and understood, even by the medical professions they are approaching. By way of example, I have constituents with profound persistent pain being accused unfairly and hurtfully of drug-seeking behaviour by doctors and nurses when all they want is for their pain to end and for their dignity and quality of life to be restored. Recent studies have confirmed this sort of response from the medical profession is a growing trend. Perhaps unsurprisingly, people with chronic pain are more likely than those without chronic pain to experience mental health conditions, including depression, anxiety, sleep disturbance and fatigue. It also takes a huge toll on other family members. It's hard to see someone in constant pain. Honourable Speaker, when chronic pain sufferers are hospitalised, they spend longer in hospital than most people without chronic pain. There are, of course, huge costs to the economy, but I'll let the Liberals talk about those. Although the causes of chronic pain are not well understood, those experience socio-economic disadvantage are almost twice as likely as those who aren't not socio-economically disadvantaged. What is not acknowledged in the community is when chronic or acute pain gets so bad that it leads people to take their own life. According to the coroner's report on suicide in Tasmania between 2012 to 2020, is that 63% of the women who took their own life during that period had been recorded as suffering from chronic, acute or cancer-related pain. Only 4% of those cases were considered as having a terminal illness. According to a 2019 report by Pain Australia, suicidal behaviour is 2 to 3 times higher in people with chronic pain than the general population. Honourable Speaker, we can't know how many of those people took their own lives, did so because of the physical pain they're in, but it is an issue that warrants much more attention and government resources to get a better understanding of this. Access to pain management. I want to talk about access to pain management services. We know from the work done by a parliamentary committee in 2022 into rural health services that pain specialists and rheumatologists are incredibly difficult to access, particularly for poorer rural areas where the services are so badly needed, resulting in significantly longer wait times. The inquiry noted that in order to access specialist rheumatology and pain management, patients from the north and northwest had to travel to Hobart or Melbourne in some instances. It is worth noting a petition was tabled today in this House, signed by over 1,000 people, which requested recognition of the need of North and Northwest Tasmanians to be able to access appropriate clinical care, including treatment for arthritis and persistent pain, and the establishment of permanent northern-based rheumatology services and persistent pain clinics, which still hasn't occurred. This remains an ongoing issue. In the time left, I want to talk about access to medication, because this can often be the only way many people are able to manage their pain, particularly as it can take such a long time to get in to see a specialist or access multidisciplinary or non-prescription treatment options. Since 2020, opioid restrictions imposed not just in Tasmania but nationally have made it harder to access some of the most effective pain management. While there are sound policy justifications for this, what hasn't been considered is the impact this is having on pain sufferers, with many who are feeling stigmatised, targeted or punished, and some simply not receiving the medication they need to manage their pain. It has also increased costs with more visits to GPs, which on the northwest are difficult to get. This is why people are turning to medicinal cannabis. But that is too is very hard to access in Tasmania and extremely expensive, even though we have a burgeoning industry of commercial medicinal cannabis cultivation in this state. Those that have difficulty accessing pain medication legally can be left with no option but to pursue it illegally, criminalising what is a medical problem. I'll have a lot more to say about this in the coming months, but I want to start the public conversation today because it needs to be had. Thank you.